Hello, everyone, and welcome to the Your Mark on the World show. I'm your host, Devin Thorpe. I'm a Forbes contributor covering social entrepreneurship and impact investing. Our guest today is really a remarkable social entrepreneur. Kelli Kelley is the executive director of Hand to Hold, an organization that supports families of premature babies. Kelli, welcome to the show.
I am delighted to be here. Thank you so much.
Well, we're thrilled to have you. I think we need to start this story with a little bit of a discussion about your personal situation. You didn't get into this randomly. You've had not one but two children born prematurely. Tell us a little bit about that experience.
Absolutely. Well, we thought we had done everything right. Didn't miss any prenatal vitamins or doctor's appointments. We're so excited to be having our first baby. And I was driving home from work in rush hour traffic and just incredible pains through my abdomen, and really thought it couldn't be labor because it was so early in the pregnancy, but I knew, something wasn't right. And when I finally made it home, we joke about this now, but we called our parents because we didn't know enough about what to expect, even though I had read all the books up until that point. But we knew our moms were the best source of that information. So his mom asked me a series of questions and told us to call 911. So we were taken to the hospital. They really didn't feel like anything was wrong with the baby. They had assessed me and assessed the baby. But as we approached the hospital, they told me that I was in labor and they weren't going to be able to stop the labor. So things progressed very quickly. It was kind of like a scene out of the TV show ER, and lots of doctors and NICU professionals there for the birth. And so he was born at 24 weeks. So that's 16 weeks preterm. And at the time, that was the cusp of viability. We are seeing babies survive at 22 and 23 weeks now due to amazing medical advances. But so he spent 4 very long and difficult months in the NICU. Of course, those first few months were extremely challenging, lots of setbacks and challenges. So there were many times that we thought we were going to lose him. So we know what an amazing, precious gift we have been given. He's had quite the struggle. I'd say the first 5 years were extremely difficult with other surgeries and lots of occupational speech, physical therapies.
Mm-hmm.
And he's doing spectacular today. I shared with you earlier, he's 16 and learning to drive and wanting to date and doing fabulous in school and very athletic. So we couldn't be more proud of him.
Wow.
Baby
It's
sister.
really a very hopeful story for people.
Yes.
What
Yes.
happened with your daughter?
Well, she was born when Jackson was 2.5. We had been told that they thought that I could carry a baby full term. They didn't really expect us to have a second premature baby. And she was born at 34 weeks. She was having complications due to a blood disorder and had to be delivered early. And she spent a week in the NICU. But she did scare us pretty badly. She had jaundice and had to have some blood transfusions and medications. And those led to some learning challenges later. So she also had some medical and developmental challenges throughout her elementary school years. But she's 14 now, beautiful young woman. And she and I volunteer together in the National Charity League, and she plays competitive volleyball. So again, I have the Cinderella story. It was a difficult beginning, but they have done very well.
So there's great hope that comes in the long term, at least from your experience, but clearly it wasn't all roses through this process. Tell us a little bit about how you felt and the impact on you and the rest of the family as you were going through this process, because I think that help motivate what has come since.
Absolutely, it did. I felt very alone and isolated and, of course, traumatized. And no one really talked to me at all about the higher risk for depression and anxiety and and PTSD. So, I was really on my own to figure out what is going on with me. Why am I feeling this way? Why is my husband reacting this way? This was, throughout the NICU stay, but even after the baby came home, we had ongoing challenges. So we know now up to 70% of parents are experiencing anxiety disorders and depression during the NICU stay. We are being diagnosed with PTSD often many years after our traumatic birth experience if we have not sought treatment early. And that has a direct impact on the baby's medical and developmental outcome, because as you might imagine, if the parent is experiencing depression and anxiety, they're not bonding with their baby and they're not participating in the care of the baby in the NICU, and then they're often not ready and prepared to meet the needs of a medically fragile baby once they come home. So just last year, the National Perinatal Association published new standards or new guidelines for the care of the parent during their NICU stay, calling for mental health support services, be it peer-to-peer support, therapist in the NICU, education during the NICU stay, to help us mitigate some of these challenges that we're seeing. So they're actually saying they want the mental health support of the parent to equal the medical care of the baby, which I think is transformational, because we're spending millions of dollars to save these tiny little babies, but then we're sending them home with parents who are traumatized, who are struggling with anxiety. We have a higher rate of separation and divorce. We have a higher rate of child abuse, and we are struggling emotionally, financially, psychologically. So we need lots of mental health support to get us ready to meet the ongoing needs of our baby. Like I said, Jackson's first 5 years were full of speech therapy, occupational therapy, and he had to have multiple surgeries after he came home, medications. He still takes multiple medications. So parents need a lot of support in preparing for this different parenthood. It's not what we expect or plan for when we decide that we want to have a baby.
So let's talk a little bit about the organization, Hand to Hold. So you started looking for resources as you identified the stress in your own life. You started looking for these resources, didn't find them, and you created Hand to Hold. How did that all begin?
Well, I'll tell you, if I had known how hard it was going to be, I might not have done it. So I'm glad that I didn't know what I didn't know. But I just started reaching out to other organizations that provided support, mainly for the babies. You were seeing early childhood intervention, there's Easter Seals, there's a lot of organizations that serve the children. And I started trying to identify what are the services for the families, and calling and looking for support groups in my area, looking online for information, credible information. At the time, it was, Jackson's 16 now. So at the time, there was such a wealth of information. I didn't know what to trust and what was the right information. And I could not identify support groups in our area. And then there was the challenges of, I had this medically fragile child that he had his immune system was such that I couldn't take him out of the house. So how am I, now that we are having financial challenges because I had to quit my job and I have this baby that's home and has medical needs, how am I going to seek therapy and get support when I'm isolated at home? So really just taking a look at kind of the ecosystem for the NICU family in our community, and decided that I needed to try to do something about it. I was trying to get other people to do something about it, and they said, why don't you take that on? And I really thought that was much bigger than anything that I could handle. I had a background in public relations and marketing, but had no idea how to run a nonprofit. But what I found out is it's really about passion. It is about setting these goals for yourself, overcoming fears of things you don't know how to do, hiring people that know how to do things you don't know how to do, and putting together an amazing board and staff and volunteers to to see that dream come to light. And that's exactly what we've done. And I could not be more proud of what we've accomplished in a very short period of time. We have a national peer-to-peer support program. We actually serve people outside of the United States now, where parents connect with us and ask to be connected with a peer mentor. And so through our social work team, we match them with our trained volunteers who have a similar story. So very important if you're a mom of a 24-weeker and your baby has experienced a brain bleed, that we match you with someone who is many years out of the NICU, have had a similar experience, so they can mentor you and hold your hand. That's what we're all about, is holding your hand and helping you navigate this new experience.
Well, I imagine that not every premature baby survives. And that must be a particularly challenging thing for them and for you as personally, and for the organization, to figure out how to comfort someone through the tragic loss of a baby. How does that work?
Well, it's very similar in that we match people with other parents who have had a similar loss, because no one really understands what you're going through if they haven't had that personal experience. So again, very important, matching them with people who understand. Our trained social workers who have had lots of experience. Many of our social workers also have experienced NICU stays and their own loss of a baby. And so it's coming from a very personal place, but also that level of professionalism and training behind that coupled together. So I don't know that you can ever prepare someone for the loss of a baby. I think it's just letting them know they're not alone and helping them see that what the possibilities are down the road, and seeing that, you know, those of us who have experienced preterm birth, those of us who have experienced a loss, are leading full lives and have, you know, in some cases gone on to have other children. In some cases we have adopted. In other cases we have put all of our efforts towards supporting causes that we really believe in, like improving healthcare for babies.
Yeah. Well, you know, healthcare for babies is an important question, and I want to ask about the experience of the families, especially with respect to finances and how they're feeling today. We have, over the last several years, premature babies have been in a fairly improved situation because Obamacare removed caps, and caring for babies is extraordinarily expensive, isn't it?
It is.
And so in those who have insurance, and that isn't everybody, but those who have insurance at least know that their baby will be cared for, right?
That's right. And all babies will be cared for, regardless of insurance or not, in the NICU. Now, for those of us that our babies are born under a certain weight, they automatically qualify for Medicare, Medicaid, and different programs. So luckily, there is no restriction on what kind of service and support they're going to get in the NICU. But I will say, even for those of us who have great insurance, it's still very difficult, because once you bring the baby home, a lot of our medications are very expensive. They are not covered. A lot of our therapies are expensive, but not covered. My husband and I, like I said, I had to quit my job to stay home because of their baby being medically fragile. So you're losing an income. Some of the shots that we take are $2,000 to $3,000 a piece. So there is a lot of out-of-pocket expenses and things that we have to learn to advocate for. And so what Handlehold really wants to do is help parents navigate that system, learn how to advocate for the baby, to get the right services for the baby, to find out what do they qualify for, how to work with the insurance companies to make sure that they are getting the coverage that they should for their children and for themselves, what mental health services are available to them through their plans or other programs that are subsidized.
How does your organization and your community react to the Republican proposals on health care that have been circulating the last few months?
Well, I'll say that Hand to Hold does not typically take a voice in those stands, but I am a part of the Preemie Parent Alliance. It's a national organization of parents like myself who have started organizations and advocate across the country for our children. And that's where we look at what proposals are being brought forth and speaking out. We do a lot of speaking for our legislature and in our own communities about what the needs are of our families. So I've had the honor of speaking multiple times to our congressmen and representatives about the struggles our family has had. I've even had the opportunity to meet with our governor. So I think, just sharing our personal experiences, the experiences of the families that we serve, knowing that, Hand to Hold touches hundreds of thousands of families every year, and I'm their voice and hope to continue to be that voice.
And what's the message you deliver when you talk to the congressman? What do you tell them policy-wise that they should be doing?
I think it's just really important that we are looking long term. Investing now in our babies means that they are going to meet their full potential. They're going to be kindergarten ready. We're going to keep our families in the workforce. I mean, if you're having families that are dealing with mental health challenges related to preterm birth or a traumatic birth, they're not going to be returning to work. And so then we're calling on all of our, federal funding for other programs. So we want to make sure our babies are ready for school, that, there are success stories like my son, born at 24 weeks, but now preparing to go to college. So just don't look at us just right now on what's happening in the hospital, but let's look long term and how does this impact us from a community and, throughout our country and globally as well, because prematurity is a global problem.
Sure. Well, Kelli, you are an amazing individual and revered and respected in all kinds of circles. But who do you look up to for inspiration? Who's your role model?
Well, I start every morning with a podcast. It was started here locally in Austin. Now it's a national podcast. It's called On the Dot, and it features women leaders every day. So it's the first 5 minutes of my day, and I find that very inspiring to see what women are doing across our country, around the globe, to improve outcomes in our communities and across the country for causes that we believe in, be it our small businesses, our passion work like I'm doing to better healthcare for families of NICU and bereaved families. So I would say all of those women, but particularly I really admire our NICU nurses and our neonatologists, those that are there and working with our families every day. I cannot even imagine that being my job and those precious babies being, in my care. So I love and appreciate them. They gave me the life of my babies. Without them, I would not have my children. So really admire our medical professionals.
Fantastic. Well, we've spent a lot of time kind of talking about what motivated you to do this, but I want to zero in a little bit on one particular aspect. There are a lot of families that have experienced what you experienced, that have had premature children. Why did you feel responsible to pick up the ball and do something about it? Because most don't.
Now you sound like my husband. It's like, why does this have to be our problem? But he said he knew very early on in our NICU journey that I would become an advocate. I think it's just in my bones and in my blood to speak up and try to change things, make things better for others who come behind me. But I also said, if I had known how hard it was going to be, I might not have done it. But what a blessing it has been. And we haven't talked about the podcast yet, but we just recently launched our first podcast. I love podcasts, and I had listened to many different genre and had come across a story about a couple who had a baby at 23 weeks from Radio Lab. And I was just struck by their story and how emotional their story was and how impactful, and thought, wow, we could totally take what we're doing in the hospitals, our support group curriculum, and turn that into a podcast to reach more families. Because, like we've already talked about, mental health services funding is critically low for families like mine, and access to mental health support and support groups. So, what we're trying to do through this podcast is just make it accessible for anyone with a computer or a smartphone, so that they can hear the voices of other NICU parents, NICU professionals, counselors, and therapists. So it's called NICU Now. We've been downloaded in more than 30 countries now, and we're averaging about 1,000 listeners a week. And we are just ecstatic because seeing this go globally and helping break down barriers to getting support and information has always been my dream. That's what I wanted. I wanted support for all families, no matter their income level and no matter their language. Let's just take down these barriers to make sure that everybody has the support that they need.
Sure. Kelly, what's your superpower?
Superpower. Oh, goodness. I don't know if I truly have a superpower, um, other than surrounding myself with amazing people. I think just knowing kind of what my limitations are, and I have a sixth sense for identifying just really smart, passionate, amazing people. If you could see my staff when we gather for our staff meetings, and just the passion they have for their jobs and the mission of our work. And so I would like to think that's my superpower, is just really bringing together, uniting people to make change.
Oh, that's great. I really, really appreciate you sharing that. Now, before you go, and I appreciate you taking the time to be with us today, Kelly, tell us how people can learn more and how they can connect with you personally.
They can reach out through handtohold.org. So www.hand2hold, and you spell it out, TOHOLD.org, handtohold.org. And I'm happy to receive an email from any of your viewers or listeners at Kelly, Kelli, at handtohold.org.
Fantastic. Well, Kelly, we thank you very much for taking the time to be with us, and wish you every success in bringing care and comfort to the families of premature babies.
Thank you for this great opportunity. I truly appreciate it.
All righty. Let's do some good.